Thank you for the opportunity to present today. Our team consists of Dave Moret, Maria Kiriazis, Phoebe White and myself, Jason Stone, and we will be introducing our app called Your Medic. In 2018, 3 million people presented to New South Wales hospitals, and of those, 1.5 million were considered to be more appropriate for treatment by a general practitioner. In hospital, they averaged over 2 hours before seeing a doctor and spent over 7 hours before being sent home. Currently, 11,000 general practitioners work within New South Wales who are considered more appropriate to treat these patients. Furthermore, 88% of Australians own smartphones, with over half using health-related apps daily. Research also suggests that most GPs utilise medical apps, and those who do not are considering obtaining them. Your Medic asks quality assurance questions, triages the information, provides the closest and most appropriate GP's address, the earliest available appointment time for booking, and then provides GPS directions to the location. It was identified within the first round of testing that the next steps included isolating the innovative features that would be feasible and most beneficial to customers and testing the hypothesis of whether GPs would see value in adopting the service. In May 2019, 14 customers were interviewed regarding valuable app functions, resulting in all requiring Google Maps functionality, 13 requiring the ability to book GP appointments, and 3 requiring links to public transport and Uber apps. Second round testing, conducted in May 2019, identified that 72% of 141 GPs tested utilise medical apps, and 94% of those who do not have medical apps are considering obtaining them. This research identified that medical apps are widespread and that utilisation is increasing. As a result of the research, it was concluded that due to GPs being accepting of medical apps, the likelihood of them using and seeing value in this innovation is high. The business model canvas identifies 2 customer cohorts, which includes GPs and the customer, or end user. In 2017-18, Health Statistics identified that the size of the GP market within New South Wales exceeds 11,000. And as mentioned earlier, 1.5 million people in New South Wales presented to hospitals who were considered more appropriate to attend GPs, creating a very large end user market. For many businesses, market segmentation within an industry is regarded as the panacea to success. However, identifying which segments to target within an increasingly diverse IT market is extremely challenging. Our target age is between 35 and 64 plus across both sexes, and the demographic social class spans from lower, working, middle and upper classes. The target psychographics includes health-conscious customers who value time-saving services and would also appreciate that hospitals should be saved for emergency situations only. Post-implementation within New South Wales, a Phase 2 rollout across Australia to access the 36,000 GPs will be launched. Your Medic will be entering an unchallenged marketplace, and as demand will be generated due to the lack of participants in the market with similar features, this business will operate in what is called a blue ocean. In selecting a strategic approach, 3 factors must be understood, which include the structural conditions, our resources and capabilities, and a strategic perspective. However, whichever strategic approach is chosen, success centres on the value, profit and people propositions. A structuralist approach is designed as one that aligns all 3 value propositions in pursuit of product differentiation. When structural conditions of an industry are appealing and the resources and capabilities to obtain feasible competitive position are available, the structuralist approach will provide benefits. Although working in an uncontested marketplace creates an opportunity for success, competition is inevitable and will be attracted to the market eventually. In order to restrict imitators entering into the market, we will include non-disclosure agreements and contracts for general practitioners to ensure exclusivity. I will now hand over to Phoebe, who will present on feasibility testing.
Thanks, Jason. The prevalence of mobile phones has made them an innovative app platform for the provision of patient care. Although an app of this type does not currently exist, a technological platform that incorporates medical protocols and triage algorithms does, and it's utilised across numerous organisations, resulting in technical feasibility. ProQA is risk-averse software that analyses medical information using expert logic that quickly identifies appropriate triage determinants. It has previously satisfied legislative and ethics approval within Australia, therefore dismissing some expensive setup costs. Fixed setup costs associated with the app include first year's software support, training, app development, web design, and wages totaling $94,300. It would be unwise to assume that all GPs will embrace the technology in year one, therefore considering that each GP will pay a subscription fee of $240 per annum, 393 GPs will be required to subscribe in the first year to break even. Channels identify how the value proposition will reach customers. These include a website, app stores for iPhone and Android users, and email. The channels are used to support customer relationships by facilitating after-sales follow-up, support, and rewards for repeat subscriptions. The business provides a unique selling proposition, and attracting new customers is crucial. Networking with the RACGP, who maintains membership for all GPs within Australia, expanding sales channels to government's primary health network, and connecting pharmaceutical companies will ensure that the current customer base is maintained and will also attract new customers due to the exclusive membership that these organisations hold. As key partners, their value proposition must be identified and exploited, which in this case is financial remuneration. Each time a patient attends a GP, a $36 rebate is provided from the government, so the more patients who attend a GP, the more money they earn. Key resources for the business will be contracted and are to include website and app developers, maintenance professionals, as this expertise does not currently sit within the business's capabilities. Plausible cost assumptions and projections assist to provide financial information for an informed decision about whether to progress or abandon the initiative. Second round testing suggested that 72% of GPs utilise medical apps. Considering this research, a conservative assumption is made where 5% of New South Wales' 11,000 GPs will subscribe in year 1, 10% in year 2, and 15% in year 3. A profit and loss statement was constructed showing 3-year projections and a cumulative profit of $596,280. There are numerous apps for smartphones that have been developed and are widely used by health professionals and patients. Medical apps make smartphones valuable tools in the practice of evidence-based medicine at the point of care, resulting in a great opportunity to exploit this attention by creating a triaging app for low acuity medical conditions and illnesses. Currently, the marketplace is uncontested, which has identified an exciting value proposition for key stakeholders, and as the healthcare system is becoming increasingly mobile in nature, adoption of this initiative is probable. From the results shown in this presentation, our conclusion is that this initiative should be pursued. Further, if imitators are restricted from entering the market by incorporating GP non-disclosure agreements and contracts to ensure exclusivity, the identified profit margin will be compound past the current 3-year forecast.